Hi everyone, welcome to our webinar today. This webinar is being presented by Clean Energy Group, and the topic for today's webinar is Emerging Public Health Needs for Climate Smart Technology in Connecticut Affordable Housing. And we've got an excellent panel of guest speakers with us today, but before that, I'd just like to go over some webinar logistics. We are using a new version of GoToWebinar. If you have any questions or comments about that, you can leave those in the post-webinar survey after the webinar. If you'd like to submit questions, you can do so in the questions panel on your screen. All attendees are muted and their webcams are disabled. Automated captions are available on your webinar panel. And finally, this webinar is being recorded. We'll email you a webinar recording within 48 hours, and it will also be posted on the Clean Energy Group website at cleaninggroup.org/webinars. And with that, I'd like to pass it over to our host for today's webinar, my colleague, Marriele Mango.
Hi, everyone. Thanks again for joining. Go to the next slide. This webinar was brought to you today by the Clean Energy Group. Clean Energy Group is a nationwide nonprofit organization that works to advance affordable, reliable, clean energy for all. I encourage everyone to check out our website, cleaneggroup.org, to learn more about the programs that we're working on and initiatives we support. Next slide. The project that this webinar is being offered through is the Resilient Power Project, which focuses more specifically on advancing solar and battery storage resources in historically marginalized and underserved communities. Our work focuses on technical assistance, project support, awareness building, and supporting partners on the ground doing the grassroots work necessary to build resilient power projects locally. Next slide. The Technical Assistance Fund is part of the Resilient Power Project. The Technical Assistance Fund provides technical support to build local resilience. That's one-on-one support from expert staff at Clean Energy Group, as well as small grant assistance to actually support critical community service providers and community institutions in low-income communities, communities of color, BIPOC-led communities, and actually developing their own community-led resilient power projects at a specific facility. We're celebrating 10 years of Technical Assistance Fund, and I encourage you, if you want to apply to the program or learn more, please check out our website. This is just reiterating, we're at almost $2 million in awards now as of next month, likely, and continuing to grow. The webinar today is really focusing on emerging public health needs for climate smart technology in Connecticut. Affordable housing. This report was led by Yale Center on Climate Change and Health and Operation Fuel in support with Clean Energy Group, Connecticut Insurance Department, and Connecticut Green Bank. You're going to hear from them in a couple minutes about the great work and results of that effort, and to learn a little bit more about the broader coalition as well. Next slide, please. So, webinar speakers for today. We have a packed panel. I encourage everyone, please be putting in your questions throughout the presentations. We're going to get them to them at the end. We like to leave a robust 15-20 minutes at the end for questions, so I encourage you to type those into the box. First up, we're going to have George Bradner. He's the Assistant Deputy Commissioner and Director of Property and Casualty at Connecticut Insurance Department, followed by Bryan Garcia, President and CEO of Connecticut Green Bank, Annie Harper, Assistant Professor at the Program for Recovery and Community Health at Yale University Department of Psychiatry, Darlene Yule, the Chief Operating Officer at Operation Fuel, Jesse Wescott, the Vice President of the Towers at Tower Lane, myself, Marriele Mango, Project Director at Clean Energy Group, and our Q&A will be moderated today by Project Manager Brittany Batiste-Allen at Clean Energy Group as well. So with that, I will pass it off to our first speaker, George.
Thank you very much, Marriele. And I want to welcome everyone on behalf of Commissioner Mays to this extremely important webinar today. And there's a lot of great information I think you'll find here. You know, at the department, climate change is an urgent global challenge that requires immediate and collaborative action across all sectors. Connecticut is increasingly experiencing climate-related extreme weather events such as grid outages, temperature-related emergencies that pose significant risk to the residents, especially those relying on home medical devices. Commissioner Mays has consistently highlighted the importance of building resilient communities to withstand these challenges and protect vulnerable populations. A recent report, Emerging Public Health Needs to Climate-Smart Technology in Connecticut and Affordable Housing, underscores the critical need for backup power and stable indoor temperatures in residential buildings. Public-private partnerships, including those with the insurance and public sectors, are vital for enhancing community resilience. Commissioner Mays is forming an advisory council to explore the creation of a grant program aimed at helping communities, small businesses, and property owners make their properties more resilient against climate risk. Investing in climate-smart technology for affordable housing is essential to safeguard the well-being of residents, particularly those in vulnerable communities. By fostering cooperation between healthcare, insurance, public, and philanthropic sectors, Connecticut can create a more resilient and sustainable future. Commissioner Mays invites all stakeholders to join in these efforts to protect our communities and ensure a safer, more resilient future for all. Thank you for being here today. I'd like to turn this over to Bryan Garcia.
All right. Good morning and good afternoon, everyone. George, thank you for that introduction to the report there from Commissioner Mays. We are literally 2 years nearly from the date that Commissioner Mays charged our group with launching this project. So just a big kudos to the Commissioner and George for leading us to this point. We wanted to start off with acknowledging the Robert Wood Johnson Foundation. Kimberly Cornett has been just instrumental in not only bringing us together here in Connecticut under Commissioner Mays's leadership, but just being a leader within the context of supporting other states as they grapple with insurance and resilience across the country. As many of you know, the Robert Wood Johnson Foundation is a foundation focused on health equity. And in this context, which I'll talk about in a second, they have provided grant resources to a number of states through the National Association of Insurance Commissioners, which Commissioner Mays currently chairs. Let's go to the next slide. Excellent. So when the Robert Wood Johnson Foundation came to Connecticut with the possibility of funding a project, we all got together and threw out a bunch of different ideas. The foundation working through the Center for Insurance Policy and Research at the National Association of Insurance Commissioners essentially wanted to support a number of projects in our state that would move the needle on resilience. So we started to brainstorm a couple of different ideas. The obvious one, resilient homes. So how we think about individual homeowner insurance, flood insurance, how we think about systemic resilience within the context of homes. The second one was thinking about how former brownfields might serve as rejuvenated parks. So from brownfields to greenfields, and the notion of park prescriptions, how we might see the public health industry begin to prescribe people going to parks as a public health mechanism. Neither of those two we determined were selected, but we did select our third option, which is the project that we're going to describe here today with our wonderful partners. So let's go to the next slide. So in addition to the Robert Wood Johnson Foundation, as many of you know, through the Equitable Modern Grid docket that the Public Utilities Regulatory Authority oversees, and Public Act 21-53 that established the 1,000 megawatt battery storage target for the state of Connecticut, the Connecticut Green Bank is a co-administrator of an energy storage solutions program. That is a 580 megawatt behind the meter battery storage program, half of which is through commercial and industrial, and the other half through residential. The program is intended to not only provide resilience benefits to those end use customers, but to also play a part in reducing peak demand. So to effectively socialize the benefits of those battery storage systems with other ratepayers on the grid by reducing peak demand through passive and active dispatch. We had submitted as a part of that docket a marketing plan years ago, including looking at medical hardship customers, of which at the time there are probably more today, but about 30,000 electric ratepayers, 90% of which have life-threatening conditions, were identified within the context of that plan as having home medical devices. So we had an effort or an idea to raise awareness around this important market segment as this program began to unfold. We, in fact, identified our partners that we're going to talk about here today as a key part of that program. Let's go to the next slide. So we came up with the project, Climate Smart Technologies and Home Medical Devices for Affordable Housing. So when you think about climate smart technologies, I think all of us these days think about not only solar power to decarbonize, but also the other side of the equation, battery storage, to make ourselves more resilient to the impacts of power outages. But we should also be thinking more about stable indoor temperatures, efficient heating and cooling, weatherization. Thinking about things from an energy efficiency perspective. To also enable the deployment of these technologies, which will ultimately increase the resilience of tenants that live in affordable housing that are reliant on home medical devices that we're going to hear about here today from our team. So yes, we have a wonderful team of partners. They're each going to jump into their respective roles today. We've got Operation Fuel, the Yale Center on Climate Change and Health, and of course, the Clean Energy Group. Let's go to the next slide. So in terms of our project activities, as I noted earlier, we're near the end of our 2-year grant cycle here, but these are the 3 areas that we really focused on. Today, we're going to dig really deep into the first part, community engagement. So Operation Fuel, working with Yale, their focus was to really engage residents within affordable housing to try to understand how they would deal with or become more resilient from the impacts of climate for those who lived with a home medical device need. So we're going to hear about this really important social science research today from Operation Fuel in Yale. The second part was to dig in deeper and provide technical assistance to properties around the state. So the Clean Energy Group with American Microgrid Systems has a great program where they go out and provide technical assistance to understand the potential and the economics around the deployment of solar storage and other solutions. So we're going to hear about that work too a little bit today. And then lastly is, of course, we want financial assistance. We want technology to be deployed so that we can help tenants realize the benefits from these technologies by financing them, providing access to capital to them so that they can get these technologies deployed. One more point before I go to the last slide on that is, the green bank model has demonstrated how green banks, nonprofits, quasi-publics, public entities acting as financial providers, capital providers in the market, have demonstrated how we can work with the banking sector to attract their private investment in clean energy deployment. This project will be a success in the years ahead if, on number 3, we're able to engage the public health care sectors and the insurance sectors to be side by side with us investing in these projects as well. So I think that is a goal of the Robert Wood Johnson Foundation and a lot of what Kimberly Cornett has sought to achieve with a project such as this. Let's go to the next slide. All right, so before I turn it to Annie Harper of Yale to work us into the report, just in terms of what's happening here in Connecticut on financing multifamily affordable housing, we are fortunate to have a policy climate that we've worked really hard on over the years. The passage of Section 2 of Public Act 2148 was a really, really important policy that passed several years ago. Senator Lopes led that effort, and it has taken us a couple of years to get all those rules in place through our partners at the Department of Energy and Environmental Protection, the Department of Housing, the Connecticut Housing Finance Authority through a regular process overseen by the Public Utilities Regulatory Authority. We believe we have all of those pieces in place to enable more investment in affordable housing when it comes to solar and storage. But we've also, of course, now got the Inflation Reduction Act, which provides an incredible amount of additional resources in terms of adders for low-income and disadvantaged communities, energy communities, and the like. You all know about them. And then, of course, we've got our Solar for All program with DEEP here in Connecticut that is going to be targeting multifamily affordable housing deployment. So stay tuned for our teams rolling out these financial products to help tenants realize the benefit of these technologies, making their facilities more resilient. All right, with that, let me turn to Annie Harper, our Yale partner, to get into the study. Annie, let's turn it to you.
I think it's actually Darlene is coming now from Operation Fuel, no?
Yes, thanks, Annie. And thank you, Bryan, for setting us up for a good kickoff here. Could you go to the next slide, please? Thank you. Hi, everyone. I'm Darlene Yule. I led the Operation Fuel Community Engagement Project team for this research study. And I also want to just take a moment to thank RWJF, all of the partners, and the seemingly countless number of Yale students that helped out in this research. We'll get more into that a little bit later. But I just want to let you know that I'll be guiding us through the design and structure of the study, and then hand it off to Dr. Annie Harper to discuss the outcomes and recommendations for future consideration of resident well-being and security. Next slide, please. As previously mentioned, the study's purpose was to enhance our understanding of medical and energy needs of residents who live in affordable housing and rely on home medical devices. So the timeline you see here represents the majority of the activities conducted in the study, including research development, data collection, and analysis. And a few additional interviews were conducted after the represented timeline. So just a super high overview here. We worked with 2 different researchers and 2 different Yale classes to conduct a comprehensive research study around the needs of affordable housing residents who utilize home medical devices. Next slide. All right, so in the spring of 2023, in conjunction with Dr. Laura Bosey and the students in the Yale Clinic in Climate Justice, Law, and Public Health, we developed the original methodology for the study. The parameters were submitted to the Yale Institutional Review Board for approval, and they had to be thorough. We defined what we consider to be a home medical device, which was largely restricted at that time to life-supporting equipment such as dialysis machines or ventilators. We also outlined recruitment measures using the Connecticut Affordable Housing Properties List. Housing sites were prioritized using the Distressed Community Index for Connecticut. Property owners and managers were set as the primary contact point for recruiting residents, and study participation was incentivized with a $100 gift card. The study included a focus group guide, which provided research interviewers with a set of questions to lead the conversation with residents and to ensure that all steps were followed in the research process and to maintain continuity. This methodology also outlined using the rapid assessment process for qualitative analysis. This method is frequently used to provide efficient coding and categorization of data without compromising integrity, especially when qualitative data collection happens over a very short period of time, concurrently with ongoing recruitment and as the situation evolves rapidly. And last but not least, we developed a strict protocol for maintaining confidentiality of study participants. Once we received IRB approval, the initial outreach and data collection started in the late spring. We utilized various outreach and recruitment methods to garner interest in study participation. Next slide. This is a sampling of questions included in the focus group guide. You can see here that the research team wanted to understand the existing situation for residents, as well as what challenges or opportunities could be leveraged in the future. The set of questions was standardized, but as you can imagine, residents had much more information to share than what we could have planned for in the development phase of the study. Annie will share more about that shortly. Next slide. Then in summer of 2023, Annie took over as the lead on the Yale side of the study with 2 students, Matt DeVito and Gabriele Vargas, continuing data collection and analysis for the summer. The spring class had provided a transition memo for future researchers. This acted as an informational handoff and assisted researchers in maintaining continuity between semesters. Operation Fuel hired our first climate and health intern, Claire Lee, to assist with the study over the summer. She worked closely with our community engagement team members at that time, Kayla Palala and Brittany Bettis-Allen, to refine the outreach process and expand the scope of prospective participants. We expanded focus groups and interviews to include Spanish language as part of the data collection process. Medical professionals and resident caretakers were also recruited for the study to provide a different perspective on the utilization of home medical devices. The study team narrowed in on resident service coordinators as the primary point of contact. This actually proved to be much more successful than outreach to property owners or managers, and significant progress was made in conducting focus groups and individual interviews. The RFCs provided the research team with resident contact information for eligibility screening. Next slide. Dr. Harper's fall class continued to work with Operation Fuel community engagement team to step up recruitment and data collection. At certain affordable housing properties, we utilized the snowball sampling strategy to maximize our reach, where resident word of mouth pushed focus groups to capacity. This was helpful in reaching the desired numbers, but not to maintain the study integrity. So we occasionally had to decline participation for some residents. Dr. Harper's class compiled a final report, which became the basis for the published report in this presentation. Next slide. While the original intent was to primarily conduct focus groups, we realized quickly the need to add individual interviews as part of the process due to the sensitive information that residents shared. All participants received a survey after the focus group or interview, which allowed residents to self-identify demographics and provide additional information about their home medical device use. This data was added to the final analysis. As focus groups and individual interviews concluded, analysis was conducted on the transcripts. 2 team members were assigned to every transcript for separate and individual coding. The results were then tabulated to provide a combined analysis of each transcript. Analysis began during the summer and ran concurrently while conducting additional data collection. Next slide. As I mentioned earlier, the housing sites were prioritized as being in a distressed municipality. Due to the nature of the study conducted within affordable housing, many of the residents had similar social determinants of health. A total of 94 participants contributed to the study, with 78 of those being residents that use home medical devices. The remaining 16 included medical professionals, affordable housing staff, and a community service engagement provider. As you can see from the map, most of the housing properties are located in urban areas. Including affordable housing properties from rural areas in future studies should be considered and prioritized. Next slide. And I'll wrap up here with some of the research challenges. This research study was clearly not without its challenges, and we quickly adapted to incorporate more effective methods while maintaining compliance with the original methodology of the study. Outreach and recruitment evolved over the study to increase participation. Property owners or managers often declined the opportunity to involve their residents in the study. During the summer, the research team tabled at local community events and farmers markets. However, the most successful recruitment efforts came from connecting with the resident service coordinators. This unexpected learning curve caused a delay in data collection during the initial phases of the research. Another challenge we faced was that residents often didn't feel comfortable expressing their experiences in a group format. This resulted in the team conducting about 40% of their data collection through individual interviews. While both methods were effective in gathering data, conducting individual interviews took longer to collect the same quantity of data in a single focus group, which may have had 10 or so residents. This also meant analyzing more transcripts than we had planned for. All of the Spanish language data collection was gathered through individual interviews. All the data gathered provided a wealth of information, much of which we didn't anticipate. Dr. Annie Harper will now lead you through the outcomes and recommendations of the study.
Thank you, Darlene. So I'm really happy to be here again. I'm an assistant professor in the Department of Psychiatry, but I co-teach a class, the Clinic in Climate Change and Public Health class at the Yale School of Public Health. Just to reiterate a couple things, as a qualitative researcher, we are looking to take seriously the voices of people who have relevant lived experience. So what I'm going to present now is what people told us. We analyzed it to make sure that we've summarized the themes, but we're not trying to kind of make judgments about people's opinions. Also, I just wanted to reiterate thanks to Gabriela Vargas, also Alex Rachman and Matt DeVito, as well as the other students from the clinic class, because really they frankly did the bulk of the work, as well as Claire Lee, the intern at Operation Fuel. So the first thing that we wanted to share is that unsurprisingly, there's heavy dependence on electricity, right? More than 2/3 of the participants or people we spoke to actually depended on more than one home medical device, and there's a different range between things that you can charge, things that have to be constantly plugged in, or things that can use batteries. And I think the most interesting finding here was that when we were asking people about, our list of home medical devices, people were actually talking about other kinds of devices or electric powered things that they rely on for their health. People talked about cell phones not only for just essential communication, but some cell phones were connected with medical devices and had kind of automatic transmission to medical providers. Somebody talked about the things in bubbles here are all quotes from what people told us in focus groups or individual interviews. So somebody relied not only on an electric wheelchair to move around, but actually a lift to be able to get in and out of their bed. And a medical doctor that we spoke to really said that for the kinds of chronic conditions that she's regularly dealing with, there's electricity is required for multiple needs that all relate to health. So I think the finding here is really that home medical devices, it's not helpful to have a restrictive list, right? People depend on electricity for their health in a multitude of ways, depending on whatever happens to be their illness. One of the things that I did want to mention here is air conditioning often came up as a real health issue, and we are currently conducting interviews with people with serious mental illness, especially schizophrenia, because we learned through the course of this research that that's a population that actually during extreme heat events are much more likely than other groups to experience health problems and even fatality. So that research is ongoing, which will be kind of an appendix to this. So next slide, please. So this is again sort of an obvious finding that if somebody is using some kind of home medical device and they lose power, there can be severe health consequences, even death. People also mentioned the financial consequences that can result from losing power. For example, if someone has a fridge full of food and the food gets spoiled, then there's significant financial cost there. Loss of medications. People talked about overheating a lot and how that impacts their health. Just being stuck and not being able to leave one's apartment, and then very sort of specific medical things like disruption in oxygen supply. Somebody said it's a matter of life and death. Somebody talked about if she loses her air conditioning, that she's likely to have asthma attacks. One person spoke about something that we hadn't thought about, which is that if they lose power, not only do they need the elevator to leave the building, but they can't actually open their front door to their apartment without a device that is powered by electricity. And a medical doctor, actually, who is a diabetes specialist, suggested that although refrigeration for special diets associated with diabetes and for diabetes medication is essential, that actually the most problematic issue that arises in power outages for people with diabetes is the room becoming too hot. So that was something that we thought was interesting. And then related to that, some people had experienced power outages in the past, and I'll talk about that in a moment. But what was very, very striking in the conversations with people is the anxiety and stress around having had that experience, but just thinking about the possibility of having that experience for people who hadn't had it personally. So I think that was something we just wanted to emphasize, that this is a very frightening possibility for people who are reliant on electricity for their health. Again, an obvious point, but I really think it needs to be highlighted, because when people are super anxious in that way, it actually impacts the way that they can absorb information and the way they might respond to advice about what to do. Next slide. So we did ask people about experiences that if they had experienced power outages, and we asked them about what they had done to prepare for that, if they knew it was coming, or to manage it when it actually happened. Some people had signed up for the weather alerts from the utility company, so they felt very reassured that at least they would have some advance warning in case they needed to prepare for potential power outages. People talked about stocking up on food and water, charging their devices, making ice so that if they lost power to their refrigerator, they would, for a period of time at least, be able to keep food and medications cold. So our recommendation here was really that these alerts work, but I would say that most people had not heard of the possibility of getting alerts. So that's just to make sure that it's the norm, that everyone who could possibly need this is signed up for notifications to prepare for bad weather. Next slide. So what did people do during power outages beyond the kind of preparation that I talked about? If there's no backup power in the building, then the primary need is to go somewhere else, right, where people can get the power they need. People who had friends and family locally, particularly if those people live in a place which also hasn't lost power, but frankly, even if those people have lost power, that was the first thing that people would like to do, is to be able to go and be with the friends or relatives who have power or who can take care of them. People who didn't have a family member or a friend that they could identify, it was more concerning for them. Someone told us about, that they would try and find out about a shelter or somewhere where there is power, somewhere that they could go and spend time. We did hear people saying that they would spend time in their vehicles. So most people, I think, did not actually have their own vehicles, but those who did have their own vehicles or had friends with vehicles would say that that's what they would do, particularly if they lost air conditioning and it was too hot, is to just be able to sit in a vehicle and cool down. Some people, and this was a very striking finding, I think, that a significant number of people said that when they lose power such that they cannot power the device that's essential for their health, they actually just need to go to hospital. And people talked us through what had happened in the past, where they had to call the emergency services. The emergency service had to come and remove them from their building and take them to the hospital to be able to plug in a device. Or, as this person indicates, my best friend had to take me all the way to the Bridgeport Hospital. And the reason this was particularly striking for us, because the people who were telling us this were not sick, right? They weren't ill and in need of medical attention. They simply needed somewhere to plug in their device and to reduce their anxiety. And it just seemed an extremely costly way for that person to be able to plug in, right, is being physically removed from a building, transported either by a friend or by ambulance, and then spending time in a hospital bed, really simply because there's a working plug next to that hospital bed. Significant anxiety among people around the actual ability to move. So when we were asking people about, when there's a power outage, I think the number one most common concern was elevator use. People were very, very afraid that if the power goes out, they won't be able to use the elevator, and people who can't travel downstairs by themselves are stuck unless they have help. In one apartment building, there was a person, a double amputee, and he said that a fellow resident, in the case of power outage, would actually carry him down the stairs. So that just ensuring that people can leave the building, the elevators work, but also reassuring residents that is the case, because that was a very, very sort of primary area of anxiety. And the recommendation, right, obviously people need access to backup power. But I think also recognizing the cost savings when we don't need to take people to hospital simply to plug in their device. Next slide. Some people we spoke to had experienced a power outage in the past, and they did have some kind of backup power. And there were that was pretty much universally something that people were very appreciative of. The most common thing that people spoke about was having access to an outlet in the hallway in their building. So they knew that they could use an extension cord to plug in and at least be able to have some essential devices remain charged. As you see this one, somebody's brother is bedridden and uses oxygen. I have to push everything towards the door in order to run that cord out. So it's not ideal, but having hallway outlets was obviously, save people from having to do much worse. There was some mention of kind of, the risks of power cords and people tripping in the hallway, but that really was a very reassuring thing for most people. One of the buildings that we conducted interviews in, actually, the staff spoke of having a kind of big store of extension cables that they would distribute to people in case there was a power outage, so that they knew that people were able to plug into those hallway outlets. And then one person spoke about having a generator. I think they were speaking about some kind of personal generator that they could use in their apartment, but that made a huge difference for that person. Next slide. Something that came through very strongly in from the various people that we spoke to is that communication makes a huge difference between people who are responsible for managing the building and the services available and the residents. We spoke with people in buildings where that was extremely thorough and very, very effective. And so people felt that they knew what was available to them in this situation. Generally, communication was good in these buildings. So that was hugely reassuring for people, knowing that they were going to get forewarned if there was a problem coming up, that the building managers would have a plan in place, and that they knew what they should do when something went wrong. We also speak to, and all of these quotes here describe situations in buildings like that, where the building management is absolutely committed to not only having a plan, but communicating that plan regularly and in advance to residents. We also spoke to people who lived in buildings where that was not the case. And in those conversations with people, it was very much like, well, maybe they have this, I don't know. Or when it happened, nobody told us anything. So that the kind of level of reassurance and satisfaction among the people who did feel that they were being effectively communicated to versus those in buildings who they didn't was pretty significant. And it's not just about having the right information so that you're prepared and knowing what's going to happen if there's some kind of a situation, but also just feeling like as a resident, your input is important and you're being taken seriously and being respected. So that was very striking, the contrast between different kinds of buildings that did that differently. So our recommendation there is obviously that an emergency plan should be mandated, but that it should that plan should be based on listening to residents to find out actually what would work for them and what their experiences have been, but also be regularly communicated to people. And just a little aside here, we did speak to someone in a building and she was very, very anxious about fire, having lived in her own house at some point and now in a multi-story apartment building. Excuse me. So I think that just kind of emphasized that as people get older or if they have disabilities, it's frightening to think something might go wrong, and being regularly reassured, repetitively reassured. Older people are forgetful. We're all forgetful. That there is a plan, and reminding people what that plan is actually hugely reassuring for people. And then we also, when in talking about communication, just making the point that there clearly is significant difference between the different housing providers and the plans that they have and the ways that they communicate those to residents. So we really felt like, if those building managers were talking to each other, they'd be doing a lot of what needs to happen would hopefully happen. Excuse me. Next slide. This is something that came up that we felt was worth needed to be highlighted, was the fact that people were frequently mentioning the financial costs of issues related to home medical device use and fear of power outages. When we asked people, like, have you ever experienced a power outage? Often people were talking about times that they had experienced a power outage because they had been disconnected due to non-payment. And as the medical doctor we spoke to said, that's what my patients are worried about, is being shut off by the electrical company, not an accidental shut off or weather-related shut off. And I think that's really important when we're talking about affordable housing. We have people who may have in the past or even recently experienced living without power due to non-payment because they weren't able to afford their electricity bills. And that experience has made people extremely anxious. And also, frankly, mistrustful of the utility companies. So it's just a reality that we have to take into account. It's extremely sad to me that the significant numbers of people who have experienced power outages simply because they don't have enough money and not because of weather at all. And then related to that, a couple of people did mention that when they had to start using a home medical device, or their child had to start using a medical device, that actually the bill that they already struggled to pay went even higher. Now, obviously, anyone who's got a home medical device should, in theory, have medical hardship protection so that they don't get disconnected due to non-payment. But we were a little surprised by how few people actually knew about that, and indeed were not necessarily on that program, even though they should have been eligible. Somebody mentioned that, and this was a person who needed to be able to keep their apartment at a safe temperature, actually just didn't have AC because they couldn't afford it. And that means not simply couldn't afford the unit, but can't afford to run it. AC is expensive. The electricity bill is always bigger in the summer for people who use it. And another thing that we noticed here, a couple times I think we spoke to home health aides and nurses who were visiting people in their homes regularly, and they had real deep insight into the financial challenges that their patients were facing, the kinds of strategies that those people had available to them if there was a power outage, and what they could do. So this is one of our recommendations here, is that medical hardship protection needs to be a sort of much more automatic than it is. But also that there's a significant population of medical providers who are in people's homes regularly, and they really have insight into what works and what doesn't work, and should be informing any development of codes, etc. Next slide. And then I think this may be the last slide, but we did ask people, what would be helpful, right? We specifically asked, so if buildings were required to have a common space where you could go if there was an outage in the rest of the building, what would that be like? And generally that would be very much appreciated. People were concerned about privacy. They were concerned about having adequate places to plug in. Some people spoke about the anxiety around, like, what about food? Will there be, will my medication be safe if I'm storing it in a refrigerator and other people are using that? So there was definitely anxiety around it. And there were some people who said, absolutely not. I am not. I need to be in my own space. I'm not going to a community room. So even though this is clearly a necessary intervention that has to be made, and it would work for most people, I think we have to be aware that there's probably going to be a minority of people who will absolutely not, would not be willing to use such communal space, and some kind of accommodation needs to be made for people in that situation. And next slide. Next slide. And then maybe related to the point I made a couple of slides ago, there was people quite frequently brought up the worry about cost when we were talking about, like, solar power or backup, batteries, or the kind of climate smart technologies that would likely be implemented. A number of people were concerned that the cost might somehow be passed on to them, and they were already struggling to cover their basic needs with their minimum, with their low income. So there was definitely concern around that, like, yeah, that would be great, but it's not realistic because we can't afford it here. So we heard that from building management, but we also heard it from residents, again, who were just afraid that that they wouldn't be able to afford the protections that might be available for them. So I think it was just important to recognize that people are worried about this, and to clarify from the start that costs must not be passed on to residents, and to also ensure that if you want buy-in from residents, they need to be reassured that it will not have financial repercussions for them. So I think I'm done, and I will pass it on to the next person.
I believe Jesse's next. We want to go to the next slide.
Yay.
Thank you, Annie. Perfect. So before we get started, I just want to quickly acknowledge all the panelists. Very humbled to be a part of this amazing group of professionals. A special thank you goes to Bryan Garcia for bringing the towers into this project, and a special thank you as well to the Robert Wood Johnson Foundation. You know, anytime that we can discuss our model like we did with Annie, it allows us to share our unique model and its unique needs. It was neat to see some of our quotes in Annie's presentation. I was like, I know that person. Now let's look at the intersection of green energy and older adults in an affordable living space. So the towers, most folks in New Haven hopefully know of us. We've been around for 50 plus years. There's some demographics on the residence piece. If we can hit the next button, it'll bring up some information on our buildings. So we've got 328 apartments. We've got 2 buildings, 178 apartments in the gray taller building and 150 units in the brick building on the right there. The taller building, Tower 1, is master metered, and the brick building, which is Tower East, has individual meters. So when we look at resiliency and we look at green energy, we're very unique in that one size doesn't fit all. And we want to talk a little bit about how we've utilized green energy and how we're looking into resiliency with our population. Next slide, please. So in 2018, a large number of our management team, myself included, joined the community and went on a listening tour to find out what people needed and learn more about the community. And what we learned was that some of our residents were frequenting food pantries and soup kitchens. And as we started to tour these apartments and meet everybody, we noted that residents had freezers full of high sodium meals, pre-made meals, and it was a challenge. And we learned as we talked with other HUD communities to keep a meal plan running, and most that are funded like the towers have closed down. So we needed to find a source that could help us to subsidize meals and also pay for in-house programming and volunteer coordination, because without purpose, studies have shown that older adults don't stay in a living setting like ours as long. And what Annie alluded to was huge for us, which is to address the risks of power outage and create systems related to safety for our seniors. So because we are independent housing with services available, we can have somebody who's 62 and working, and we can also have somebody who's 100 plus. We house people who are on hospice. We have people who are using different variations of medical technology and oxygen machines. And so it really was an area of focus for this team to be able to go through and find ways that we could bring funds in to support programming, but also build systems and look at infrastructure fixes to be able to deal with power outages. Next slide, please. So our first thought was solar. At the time, solar was big in a lot of the affordable housing spaces. A lot of our peers that we talked to were using solar. When we really started to dive into it, our buildings really aren't suited for the traditional manner. We're tall, we don't have a ton of roof space. One of our buildings does cast a small shadow on the other, and we are in the pre-development phases of looking at a third tower. So putting something out in the parking lot or putting something on the road front didn't make sense for us. So as we started to explore solar and started to look in the green energy space, we learned about cogeneration. Next slide, please. And hopefully most folks on the call understand it, but for those of you like myself who didn't back in 2018, Cogeneration is combined heat and power boiler. And for a building like ours, where you have a master meter in the larger tower of 178 apartments, it made a lot of sense. We had a one big power bill, and if we could reduce that in the way that we set it up through our charitable foundation, and we'll talk about the way that we funded that in a few slides, it made the most sense for us, and we've really reaped the benefits of that. Next slide. So we needed to approach the cogeneration boiler a little differently than most communities and most municipalities. What was important for us was that we buy the machine rather than leasing, because we needed to ensure that all of the funds generated and or saved could be used to finance that volunteer coordinator position or work on our in-house programming and hire somebody there. Those are expenses that HUD doesn't finance or doesn't subsidize. So in order for us to have what we felt was a complete package for our residents, that was something that we needed to do. So our team put together a really nice campaign of grants, Department of Energy funds, and we had the ability to sell tax credits. So when all was said and done, next slide, please, we had the ability to go out and purchase the cogenerator. And I wanted to share a little bit of the some assembly required slides and give an acknowledgement to 2G, who is our partner in this. They provide all of the maintenance and they provide all of the service. Next slide, please. Looking at the dollars and cents of this, and these numbers are a few years old for cost. The initial investment was a little bit over $600,000, and what was important for us was having a system or a generation method that could go from generation to generation, because that is one of our core values. So we looked at this project on a 25-year period, and if you look at where we budgeted the initial savings, it equals out to about $2 million over the complete life of the cogenerator. And what that means as far as our residents, when it came to subsidizing them, if we could subsidize a goal of 50 residents for about 1 million meals over a 25-year period, they would have a very small copay of about 25 to 30% of their adjusted monthly income, which we felt, given that people were spending the money on those sodium-laden prepackaged foods, that was really in line with that and offered them the ability to have social engagement down in our communal dining space and have meals put together that were reviewed by a dietitian and were much more nutritious. Next slide, please. So here's a slide of essentially the real dollars and the cents. We look at the gas that was used, and we look at the electricity that was used and the electricity that was saved, and we look at the impact and essentially where we saved on having to pay the money to utilities, because that money could be recycled back into the community. Next slide. So in total, in 2022, the cogenerator allowed us to put 148,000 plus back into the community. Next slide. And what that meant for us is that out of that 148,000 and change, less the projected savings of 78,000, we had an additional $70,000 of unrestricted funds, which could be used for adding more residents onto that meal subsidy, putting money towards those programs and those activities, and using the money to pay for salaries of the non-HUD paid staff, which was the volunteer coordinator and the healthy living coordinator, which is kind of an activities program person, but on a much higher method. That led us to also looking at what are some more green energy measures. Next slide, please. And so if we fast forward from 2022 to 2024, looking at everything that we have in place as a community, we have that cogeneration boiler that we talked about. We've done as many of the low flow water measures as we can. We went through 2 different rounds of window caulking and basic air sealing. We've now done 3 separate phases of LED light conversions. Tower East, the one that has the individually metered apartments, we've done all of the common spaces. Tower 1, we've done a full building LED conversion, and we've done our parking lot and administrative office spaces all in LED. We used a grant to do a boiler management system because we have a very simple boiler system in Tower 1, but that allows us to, during the shoulder seasons, allow the heat to stage up and down versus having to just turn it on. We went through a process about a year ago doing a high efficiency washer and dryer conversion. And as we renovate apartments, we go through and take a systematic Energy Star appliance replacement process, as well as looking at, in those Tower East apartments, doing the LED conversions. Next slide. And now for the really great news that we're very happy to share is the Towers was awarded $20 million in a HUD GRRP Comprehensive Award, and we'll close on those funds in 2026 and have the project completed by September 2028. So we're working with partners on larger scale concepts that as a community we never thought we would have access to. So we're now able to look at fuel cell, possibly an additional cogen, solar measures, geothermal, all of these wonderful pieces of technology that I have no clue about, but I know will make this community better. And while we're doing that, our team is being very conscious to piggyback on what Annie's research showed, which is making sure that we look at a generator that doesn't supply just our common area mechanicals and elevators, but also all of the resident apartments. We have some roofs that are showing their age. We want to look at HVAC in the common spaces, and we want to take a holistic look at how we're heating and cooling the building. And we're, again, just very thankful for all of the partners that we've met through Robert Wood Johnson Foundation. And again, one last thank you to Bryan Garcia. And our team as a whole is very excited to continue to take steps to ensure that our seniors are safe, secure, and that we're using that intersection of resiliency and green energy to increase engagement by using those funds through the Towers Foundation, which is our charitable foundation, to put the money back into the community for those positions that HUD doesn't subsidize. Next slide, please. And with that, we want to co-generate, it's a little pun right there, gratitude again, and say thank you. And with that, we will pass this along to our next presenter, which I believe is Mari.
Thanks, Jesse. Next slide, please. So my name is Marriele Mango. I'm a project director with Clean Energy Group. Clean Energy Group has been the technical assistance provider as part of the Climate Smart Technology and Home Medical Devices for Affordable Housing initiative. A lot of the work, the focus of our work really has been the technical support and assistance. So I'm going to dive into a case study of how solar and battery storage can serve medically vulnerable residents and touch on the needs that Annie, Darlene, and Jesse all spoke to. And just a special shout out to Jesse for letting me use the Towers as our actual case study. So you'll be able to see how solar and storage can actually support a real facility supporting these people right now. Next slide, please. So just a little bit of background about what is battery storage. Battery storage automatically islands from the grid during a power outage to provide backup power to critical loads. Critical load is really, it could be an outlet, it could be your refrigeration, it could be HVAC, it's the electrical services to the building. Sometimes battery storage is to select critical loads, and sometimes battery storage can support an entire facility. It just depends on the project. Battery storage does not emit pollutants. It should and can deliver electric bill savings. When combined with solar PV, which is a truly resilient power scenario, the battery storage can remain to support those loads indefinitely as long as solar is available. Fuel shortages are not an issue. You're not going to have a difficult time making sure that the natural gas pipeline isn't compromised to your system, or that diesel isn't on a shortage due to an emergency event. It's not prone to those shortages. And then lastly, it supports continuity of services. The point of solar and battery storage at critical community facilities, including affordable housing, is to maintain critical services to the people that live at affordable housing, as well as to those that work there. Next slide, please. So what was Clean Energy Group's role in this? We provided tailored technical assistance. Basically, we worked with Connecticut Green Bank to build awareness of the program. Bryan spoke about the Energy Storage Solutions Program, which is one of the most innovative and generous battery storage incentives in the country. And that's especially true for affordable housing providers. And so we worked with Connecticut Green Bank and actually talking about that program with affordable housing providers, talking about how it could benefit them. And then we worked with our engineer partner, American Microgrid Solutions, as well as with Operation Fuel in Yale to take our technical assistance approach and kind of make it more in depth by considering really unique health needs of the residents of each affordable housing development that we provided technical assistance for, and what does that look like based on the feedback that was provided. And I'll get into that a little later. So that included a specialized rubric, individualized conversations with folks like Jesse at the towers as to what they're trying to do in prioritizing resilient power to folks with medical needs, as well as really everyone. Connecticut Green Bank's program included weatherization assistance. So we had a full ASHRAE level 2 weatherization audit conducted at every facility, in addition to in-depth solar and battery storage analyses at every facility. And then we connected folks with Connecticut Green Bank's financing opportunities, so they could both learn how could solar and storage and energy efficiency measures work for my facility, what would they provide in backup power duration, what would it cost, what are additional benefits or obstacles to development, and then if they wanted to move forward with the project, be able to work with Connecticut Green Bank on a really competitive financing option if they wanted to go that route. Next slide, please. So health considerations. I spoke a little bit about critical loads. How did we incorporate that to have more of a health emphasis as part of this initiative when actually doing the solar and storage feasibility assessments with our engineering partner, American Microgrid Solutions? Part of that was this rubric. So we would work with the affordable housing providers in understanding the occupant needs and the building attributes. So for this particular example, the building had mobility impaired residents on upper floors, which means considerations for elevators as critical loads, temperature sensitive medical conditions, so HVAC, temperature sensitive medications, which meant refrigeration, medically dependent on electricity, so electricity dependent medical equipment, and then going on through the building attributes as well. What do you have that we can work with, right? Is there an existing community space that could be a resilience hub section? Is it more common areas? For this particular example on the slide, there was a gathering space with refrigeration, a kitchen, and so on. Next slide, please. So system design, when you're looking at solar and battery storage for affordable housing and you really want to make sure that you're prioritizing health, you're thinking of things like outlets to charge electricity dependent medical equipment, heating and cooling to avoid extreme temperatures and maintain comfort. As Annie had mentioned, comorbidities is a big part of having an electricity-dependent medical equipment. Typically, folks have other things they rely on, like HVAC, refrigeration for temperature-regulated medication, other issues like that. So how do we maintain electricity to these systems? There's kind of two options. One is the red plug option, which is an outlet in each unit. This, of course, could also be expanded on to be full backup power to every apartment. But at minimum, for this kind of model, you'd be looking at an outlet in each unit, which would allow residents to stay in their home. One outlet, however, means limited options, right? If you have one outlet, you're probably going to be able to do either charge your phone and your medical equipment, or have your fridge and your medical equipment, or have light and medical equipment. It's not going to be to your entire house. It's going to be kind of just enough for a suitable option so that you can have some short-term power while you wait for emergency support or for support to arrive in general. The Resilience Hub option is more of a community space in an existing affordable housing facility. So for the example of the towers, which we'll be looking at later, that's like a really robust cafeteria and community room with a kitchen. For other providers that we work with, it's like a community area that folks just hang out in during the day. It's somewhere where they know it exists and they know where it's located in. The benefit here is that you can have some more robust services because the backup power is to the entire hub, right? So you could have heating and cooling. It's a much larger space, more outlets available for medically dependent, electricity dependent medical equipment. There's usually refrigeration, one for food and one for temperature regulated medication. Communications, there's staff available. Of course, the flip side of that is you can't be in the security of your own home, right? You're in a community space sharing these resources. But oftentimes this is kind of the option for facilities either who don't have the ability to provide individual in-unit support, because oftentimes that includes a pretty major electric overhaul, or if they want to offer more services to residents, right? It's more of a sheltering in place option. You can typically hang out there a little bit longer because you have access to everything you need rather than one plug. Next slide, please. So the towers at Tower Lane. This is our case study of a solar and storage feasibility assessment that was actually conducted with these health parameters in mind. We talked a lot about, Jesse was much better at overviewing this facility than I will, so we can go to the next slide. So the health rubric for the towers: mobility impaired residents on upper floors, temperature sensitive medication. They had common HVAC supply partially. It was a master meter building for one of the towers. The other tower was not master metered, which I can dive into a little bit later why that had implications. But what we were seeing from this health rubric was that there was potential for both red plug and resilience, right? They had 300 plus units that could use individual resilience support, and they also had a resilience hub because they had like a pre-existing community space with a cafeteria and a kitchen and all that. So other than that, the critical loads include elevator, refrigeration, outlets for charging medical equipment, and that there might be some complexities in maintaining heating and cooling, which is important during extreme temperature if they're going for a resilience hub model, since common HVAC supply was only partially available. Next slide, please. So the next step in the process really became evaluating what are you interested in doing. And for the towers, uniquely enough, and this is a unique project for us, typically we support folks that are doing red plug or resilience hub or combined. This would be full building backup for both of the properties. So complete backup services to your entire household in an apartment, as well as to the community space. So a very comprehensive option allowing folks to shelter in place using the comfort of their own home, as well as the services they're used to receiving through their affordable housing provider, like the cafeteria and kitchen space. So some critical loads of this assessment included common area lighting, HVAC, outlets, elevator, lighting, refrigeration, additional units, things like that. Next slide, please. So here's a summary of results. And, I only have like 10 minutes to present, so it's going to be high level, and I'm going to focus on some of the key takeaways. But you can see here for Clean Energy Group, our Technical Assistance Fund assessments, when we do solar and storage, include 3 scenarios typically. Solar only, a solar and storage that's kind of the most economic option, and then a solar and storage that has the best resilience, so the longest kind of possible duration for backup power realistically. The towers weren't interested in doing a solar only model. They knew they wanted to dive into solar and storage, so we did a solar and storage. I'm highlighting here the results from one of their 2 buildings, the Tower East building, which is not master metered. And as you can see here, the difference in the cost between the smaller of the battery storage systems and the solar and the larger is significant. It's the difference between 1.2 million in capital costs and 2.1, right, 2.15. The takeaway that I wanted to really highlight here is that the systems for this particular project both provide full building support. The question comes down to how much backup power, how much time for backup power do you really want? And what's unique to the towers initiative as well is that they were planning incorporating a generator as well. So the entire report focused on what could solar and storage do on its own, and then what could it do if it was working in partnership with a natural gas generator. Next slide, please. So Jesse had mentioned that there was some difficulty in solar, and that is correct. This is a nice model of how solar would be planned for the facility. You have solar on basically every piece of roof space that you could possibly find, as well as a carport canopy, which greatly improves the likelihood of the solar being able to support a larger battery storage system. Next slide, please. This is the backup power, right? So for the best case scenario, for if you're doing kind of the larger of the 2 batteries that are assessed here, as well as for the entire, being for the entire building, the report saw that the typical endurance, so on most given days, backup power through solar and storage alone would provide 26 hours of backup support to 100% of the facility, which is really an impressive backup power duration for a facility this size. Minimum endurance, so like the worst possible day for solar and storage, maybe the solar isn't operating after the storm because of heavy clouds, or you can only rely on your battery, that absolute minimum is 14 hours, which is also pretty great for 100% building support when most power outages last less than 3 hours. Next slide, please. So the programs that really are making this project possible to begin with are through Connecticut, the Connecticut Green Bank. The Connecticut Energy Storage Solutions Program, which is a program for investor-owned utilities, provides upfront incentives for battery installations, and it's $600 per kilowatt hour for low-income residential systems, limited at $16,000 per residence. The big deal here is for affordable housing, that's not per facility, it's per unit. So someplace like the Towers that has over 300 apartments, that would be 16,000 times 300, right? Really, there's some caps involved in other kind of pathways to achieving it. But what we're seeing, especially in 2024, is that it's actually covering 50% or more of the actual installation cost of the battery, which is unheard of, and allows you to really maximize the size of your battery to get the most amount of benefit, because the bigger your battery, the more funding you're getting through the incentive. That's for the upfront incentive. There's also a grid services, a grid performance component to this, where there's 10 years of operational incentives where the battery is discharged by the utility during times of high demand, so that they can actually kind of improve resilience and rates for all ratepayers, not just those that are actually have the benefit of solar and storage at the facility. And those discharge hours have an economic benefit as well. And then second to that is the Residential Renewable Energy Solutions Program, which is for solar. And these programs can work in tandem with each other, really optimizing the incentives available for affordable housing developers in particular. Next slide, please. Great. So this is what I wanted to highlight. I know it's going to kind of look like a lot, but I think the big takeaway here is at the bottom of the screen. If you look at the cash flow projections for the Resilient Power 2 scenario, so the larger battery, the one that's going to offer more robust backup power duration times, the payback of this system after 20 years is over $700,000. That's enormous. With a 4-year payback for solar and battery storage of this size, that's going to support every resident in having backup power for a minimum of 13 hours and an average of 27 hours in the event of a power outage. With these kind of economics is really exciting. So not only does the project pay for itself, it pays for itself long-term over 20 years. And the Connecticut, the Energy Storage Solutions Program is only a program that's guaranteed as of right now for 10 years. So if that program got extended to 20 years, the economics of this would even improve, because you'd be able to do another 10 years of grid performance payments added onto it. And you can see that here in the all incentives line, which is the fifth from the bottom, that without including the ITC, which is the investment tax credit, and I'll show a chart for that later, the first year of the upfront incentive is over $800,000 for this project. And when you factor in the operation, the O&M costs, the operation and maintenance costs, as well as for these projects, we estimate about 12 years you need a new battery and an update for your inverters for the solar panels. That's why you're still seeing after 20 years a $700,000 payback. And that's including updating the system with a new battery at year 12. So really exciting figures. You can go to the next slide, please. The federal investment tax credit, I focus on the Energy Storage Solutions Program for the first step, because I think it's an innovative, pretty huge program that can be paired with the federal program, which is through the investment tax credit, which provides incentives for organizations and nonprofit organizations to actually install solar and storage at their facility. They've made a big change to the direct pay, which actually allows nonprofit organizations to take advantage of these tax credits without having to go through wonky equity partnerships and things like that. And so for this particular project, they qualified for the 30% baseline, a 10% energy community adder. So that's a 40% guaranteed minimum off their total project costs. And then they additionally might qualify for a 10% low-income residential adder or a 20% adder for affordable housing. That's a lottery, so we don't typically include those in the calculations. We kind of do worst case scenario and then hope for more. Next slide, please. And that's just reiterating what I spoke about here. You can see for both resilient power scenarios for Tower East that 40% ITC, a 50%, and a 60% ITC all improve the economics of the project, whether you're at 40 or whether you're at 60, and just greatly, if you can see for resilient power 2, the 60% ITC, so if you got the 30% baseline, a 10% energy community adder, and then the 20% affordable housing adder, which is a lottery, you're looking at a 20-year payback of almost $1.2 million. So these incentives through the state, through the federal government, make a huge difference, as do grid services programs and performance programs, and the savings generated on utility bills through the solar. It all combines together to make for a worthwhile system that not only makes financial sense for the affordable housing provider, but also financial sense and resilience benefits for the actual residents, especially those with electricity-dependent medical needs. And I'll say too, it's innovative in Connecticut, the Energy Storage Solutions Program. If you are not master metered and everyone has an individual unit, in order to take advantage of the Connecticut incentives, you have to do an 80-20 split, where 20% of the economic benefit of the system is given to the residents, and that just shows up on their utility bill, kind of like a community solar subscription would. You just see the automatic deduction there. Master meter buildings obviously can't do that because folks don't receive their individual utility bills. The provider pays for it. And what Connecticut's done, I think that's really innovative, is said, okay, well, instead of doing individual checks to folks, because that's not realistic, use the savings, 25% of the savings from the solar array, to go towards community improvement. That could be a community program like the one that Jesse spoke about with the meal services. It could be farm shares were ideas, but it also could go towards energy efficiency improvements. So if you go to the next slide, you'll see here that part of our program included an energy performance evaluation. And so for the two stars here, kind of 100 is the best case scenario. We had Tower 1 scoring at 31, not great, and Tower 2 scoring at 81, which is slightly better in terms of where are you on the energy efficiency scale. If you are a master meter building, you can use that 25% of mandated savings to go back towards reinvesting into the actual benefit for the facility, including energy efficiency improvements. So it's a very much cycle to cycle. You can use the savings generated to invest in more efficient services for your community or for community programming. Next slide, please. I'm just going to sum up that we also had a FEMA resilience score, which is part of the National Risk Index. It's a data set and online tool that can be used to help illustrate communities most at risk for 18 types of hazards, which are all here, everything from winter weather to cold waves and avalanches. And the index is really meant to help users better understand natural hazard risks in their community. So it shows here that the FEMA resilience score is 94 for the towers, which is relatively moderate for the county and where they're located in. I like to throw this in because it just shows once again how where you're located can impact the decisions you make on resilience. Next slide. That's my last slide. So we have 10 minutes on the end. I'm going to ask all of our panelists to jump back on screen, please. And I'll pass it over to my colleague, Brittany, to start asking a couple questions that you all submitted. Thank you.
Awesome. Thank you to all of the panelists who spoke about their parts of this project. We have a few questions, and as Mari mentioned, we have about 10 minutes, so we'll try to get through as many as we can in these next few minutes. So the first question, and I'm thinking this one is best suited for Annie and Darlene, is did you identify any specific factors that made certain residents more vulnerable during power outages, such as a health condition or a device type?
I can start there. I think the answer is actually obvious, which is limited mobility. I think anyone required assistance, basically when they require the elevator, right? Or then they're particularly vulnerable, but also anyone who actually requires assistance of an electrical powered device to get to the elevator. So I would say that that's the most challenge. And I'll say, and separately, there's another group I'd identify. And I think this is why the ongoing research talking to people with serious mental illness is so important. Is people who, because of a mental illness or any other problem, actually have real anxiety around going out and being with other people. I think that group is particularly vulnerable as well as what we know about the particular vulnerability of people with serious mental illness to being in extreme heat. Darlene, is there anything you want to add?
No, I was going to comment on both of those, Annie. And the only other piece I would add is if it's someone, and as you commented in your portion, if it's someone who's using like a CPAP or something to be able to sleep, that's not going to happen in a common space. And so, really being able to shelter in your unit, or as you said, have to go to a hospital to be connected. Those kinds of devices are also a high consideration.
And I'll add, Bryan, I'll just add that I think that part of it too is recognizing that not one size fits all, right? So the folks that are going to be served by solar and storage at an affordable housing facility, whether that's in unit as a red plug or as a resilience hub, are going to help reduce the burden that is on hospitals in the larger health network that are already being inundated by disaster-related medical conditions. So being able to treat some people or support some people to shelter in place at the facility, even if you can't support everyone because of their unique medical needs, ultimately kind of raises all ships because it's allowing the health, ambulatory services, hospitals, things like that, to do what they need to do to the folks that need them. They couldn't stay home if they wanted to, versus having a resilience hub that can support those that maybe only need an outlet or two or a safe space to access heating and cooling for a couple hours.
Great, thank you. The next question is, and I'm not quite sure who this one might be most relevant for, so please chime in if you think you can speak to it. But have affordable housing providers hit any permitting barriers when trying to install solar and battery storage in Connecticut? And I'm thinking maybe Jesse and Bryan might be able to touch on that.
Why don't I take a stab at it, and then Jesse, feel free to jump on in, given the towers experience. So we're really in the early stages of the public policies that Marriele spoke so eloquently about are coming into play. The Residential Renewable Energy Solutions Program and Energy Storage Solutions. So we're going to start to see the challenges that property owners face. Remember, all of these properties, as Marriele said, are really bespoke. They're really customized to the type of unit that we're trying to support. So you might have communities that are supported by HUD or state-backed affordable housing or community-backed affordable housing. So we really have a diverse market here, which I think is exciting, but also pretty scary, right? Because what has made clean energy focus on scale so much has been the fact that you can kind of standardize things, and as you figure it out, you can kind of scale it up and accelerate it. In this case, I think we're going to be learning a lot about the challenges. I know my team here at the Green Bank is working through, almost on a case-by-case basis, challenges for every property. But in that come learnings, and as we move ahead, projects should get simpler. But I really like Mario's presentation around resilience hubs and red plugs. Those types of opportunities that each unit is going to represent, I think are going to help improve resilience of communities. But to be determined, it's going to be a challenge, most certainly. This is the hardest market to affect, and Connecticut finally has everything in place with the federal government, the IRA on board, and all of our wonderful partners. Now we just need to demonstrate how everything works.
Bryan covered just about all of it for us. I mean, it really does come down to looking at all the options. The challenge being that we always have to try to balance between doing something that could build resiliency versus can we do something that we can maybe monetize a little bit or have a shorter payback to be able to bring those funds in to support those non-HUD funded pieces. And then the obvious challenge for us being caregivers essentially is as the technology escalates, it's more and more things that I personally don't understand. So how do we build the right team and find the right partners so that we have the best deal possible on technology that personally I'll never understand?
Great, thank you both. The next question is, and this one's maybe for you, Marriele, and Jesse, but were there any significant challenges or obstacles that arose during the assessment process, and how were these issues addressed?
Other than me not knowing what we were talking about, I'll defer to Mari. I mean, their team did a phenomenal job of walking us through and being pliable. So really and truly, I hope we were a good partner, but time will tell.
Great partner. I'll say that, I mean, what Jesse's speaking to in terms of capacity cannot be understated, right? Part of our partnership with Connecticut Green Bank wasn't just to provide the solar and storage technical assistance. It was to provide awareness building about the programs and how resilience can support your tenants and your residents. Jesse is not unique in his position in terms of the fact that like he has a lot of other things he's working on that he specializes in. Not everyone is going to be an operations manager that has a unique background knowledge of solar and battery storage. And that's why you need critical and supportive partnerships that build that capacity throughout the process. And so while I know, Jesse, you may not be an expert on solar and storage now, I hope that going through the technical assistance fund process at least was educational, not just in how solar and storage could support the facility, but how these technologies support affordable housing providers in their bottom line, as well as their residents, so that it's not always this automatic kind of like go-to click of fossil fuel generator, because that has just always been traditionally the model, and it doesn't need to be anymore. And it can be in hybrid system, it can be a solo system, but there's especially in Connecticut, there's funding available, there's incentives available, and there's financing available to help support folks get through this. So not everything has to feel like you're inventing the wheel, which can be really difficult. And then the other thing I'll add in terms of obstacles is just that, to Bryan's point, these are like, it's a tailored technical assistance for a reason. You do not have a one size fit all for affordable housing providers anywhere, not in the state of Connecticut, not anywhere. Even the simplest job is going to have like up-to-date electrics and new roof and all that is still going to have complications related to just the facility, interconnection, how much solar you can fit, how big your battery can get. So that's why technical assistance needs to be tailored. Case studies are helpful, but you really need to know how it's going to apply to your facility. And I think what we're seeing in our technical assistance fund is for every dollar invested into upfront support, $10 ends up being reinvested through capital and developing these projects. So it's money that has a ripple effect and really pays for itself in supporting the community. Bryan, I don't know if you have anything to add as well.
Yeah. Just a couple of comments. One is just from the tower's perspective is you need people like Jesse and Gus and the crew there at the towers who believe in community, right? That's central. So when you believe in it and you have a vision for your community, working with the community, you can realize the value of making life better. So that's just foundational. But two other thoughts. One is this is just a wonderful team. You know, having heard everybody present today, you can really feel the whole project in its entirety. We're continuing on. You know, the team worked so well together. The Clean Energy Group applied for a DOE grant on climate smart energy codes. So we're now continuing to try to devise energy codes that could be voluntarily adopted through CEG's leadership. So just we've had a lot of fun together. We're continuing to do work together. I guess the other observation of our challenges has been really the limitation on energy. So when we've talked about climate smart technologies and home medical devices, we're really talking about the energy sphere of solar storage, you know, weatherization, heat pumps, you know. But one of the things that's limited our scope has been that when we're thinking about water and resilience is the roof. And I'm trying to channel you here a little bit, George Bradner, is that flooding. You know, we've seen a lot of significant water related disasters. So I think 90% of all insured losses come through the roof. So we need to make sure that not only are we looking at this paradigm of climate smart technologies, but also thinking about the building infrastructure so that we can make sure the roof is super secure. but we're also seeing flooding on the ground up, on up. So how we think about that FEMA score in the context of, the towers, knock on wood, safe location on the coast, but we have other locations that are more in FEMA challenged areas. So we need to think about resilience in the water context too, outside of energy.
Bryan, thanks a lot. I couldn't say it better. It's when we look at the catastrophes that have impacted Connecticut, since Irene, they've been flood events. Irene, Sandy, Isaias, the thunderstorm, the deluge that we received in Western Connecticut just a little over a month ago. And these are events that are impacting areas that have never flooded before. And people are saying, people are saying that I've never flooded before. And we have data that shows that over 25%, depending on whether you look at FEMA numbers or the CBO, the Congressional Budget Office, goes up to 40% of losses occur outside a designated flood zone. So we really need to change this conversation and help people understand what their risk is. Commissioner Mays is committed to that, and how we can use data and information to help them understand what their exposure is. And you're right, the roof, Jesse talked about, the roofs in these buildings that need to be replaced. And there's techniques that can make these roofs more resilient to the impacts of wind, which keeps water from penetrating these structures. And that's critical, because if you get water in these structures, you can't stay there regardless of your HMDs that you have, because you start getting mold. And so these are all things that we need to be focused on, and what can we do to improve these buildings and make them safer.
I know we're out of time, but just a very quick comment, because I think this is an important connecting. An earlier question was who is most vulnerable, and I actually think the piece that we didn't draw attention to is people who live in buildings without the kind of leadership and frankly financial resources that the towers has, because we really saw a huge difference there from a resident perspective. So I just think drawing attention to how do we make this happen in places where people don't have the bandwidth, don't have the interest, don't have that sense of community, because ultimately that's what needs to happen.
Yes, so like Annie said, we are at time, but I just want to thank again all of the panelists who spoke about the project, everyone who tuned in today to join us. Again, this webinar was recorded, so we will be sharing that via email, and it will also be up on our website, and I'm just going to pass it to Mari to close us out.
Yeah, I wanted to let everyone know there's a list of upcoming webinars here. We'd love for you to join us. I'd also like to highlight that Clean Energy Group will be publishing a different report based on these findings. That's more of a deep dive into the techno-economic assessments for different affordable housing providers, including those that have less capacity, like Annie just spoke to, across Connecticut. So it'll be a full report on all of the findings and how energy storage solutions factored into each one of those projects. It's about 15 assessments that were completed and will be evaluated. So just keep an eye out for that. That should be published likely in November, and we'll have a follow-up webinar focusing on those results as well in the new year. So thank you all for joining us. Thanks for our awesome panelists, and to Brittany for moderating the Q&A. I think that this was a really great opportunity to dive into what has been, at least on CEG's part of things, an awesome partnership to learn more about how this is a holistic problem that we have holistic solutions to and comprehensive support. So thanks again, everyone. The recording will be sent out via email in the next day or two. And if you have any questions that weren't addressed, please always feel free to reach out to us at Clean Energy Group. Bye, everyone.